One of the biggest questions I get asked is which is the most important muscle in low back pain? Today I'm talking about what I believe to be the most important muscle in low back pain and why it's often missed by other well-meaning health professionals. I'm Chris, I'm here talking about low back pain today. If you're joining me, please type in below and say hello. So, low back pain, there's a lot of different theories about what can cause it and different methods and different things to try. One thing that we've been looking at here a lot over the past many years is treating low back pain a little differently. Now, why do I say it's a little bit different? Well, here's the thing. When we're looking at the muscles regarding low back pain, most of the time what people do is they look at the muscles that are actually physically behind you. Okay, so near the vertebrae on your back, rubbing through your back, doing mobs on the back, things like that. But quite often that doesn't actually get the job done. So what else can be considered? And today we're looking at a muscle which is called the iliopsoas muscle, okay? And sometimes people just call it the psoas. As a matter of fact, the iliopsoas group is actually two muscles that link together. So the first one is called psoas major, and it runs down the front like this. You can hopefully see that in the video. So you've got all of these different vertebrae, T12, L1, 2, 3, 4, and 5. And this muscle runs from the front of the spine. So it's almost like in the front, if I was to, cut all my tummy out, cut my guts out, it's right in deep underneath there. So it attaches right into the front of the spine and connects from those vertebrae down into the front of the hips, so right in through here. So that muscle is called psoas major. And its little baby brother is called iliacus, and it's right on the inside of the pelvis, right deep in here, and causes pain right at the front of the hip as well. So when those two muscles are tight, what it does is it kind of feels like that you're folded forward. If you can see where the muscle is, if it gets tight, what happens is that it pulls you forward. So it makes it really difficult to get up tall and get up straight. It feels like that you're being squashed through your back. You might even feel like that the pain in your back is so deep that you can't actually touch it. So no amount of massage on the back, no amount of dry needling on the back, no amount of manipulation on the back seems to help, but this really heavy low back pain still seems to be there. Now the missing link, of course, is this muscle psoas major, and because of where it sits, you can see what happens if it gets tight. So from this end to that end, it sort of compresses a little bit. It has a compressive force on the spine, so it makes it much harder to feel like that you can rotate freely. It makes it feel more difficult to stand up straight out of a chair or first thing in the morning when you're getting out of bed. Now, the reason why this is so commonly missed is because in the textbooks, basically the way that this muscle is described is as a hip flexor, so that it bends your knee up towards your chest. Now that's true because this muscle, the iliacus, does that, and there is a little bit of force that allows the body to do that. But you can see where the center of gravity is, and most of the muscle above that, okay, has no impact on the knee to chest movement at all. And in fact, it has only the function to compress the spine, stabilize the spine, and give some spinal flexion forward because of where it attaches. So if you've never had anyone actually check this muscle before, actually very gently push into the tummy and have a feel of what's going on through there. Now I will say to all the people out there that you can't actually touch the muscle directly because you've got a whole bunch of other organs and intestines and stuff over the top of it. But you can get a really good gauge of what's going on through there by some special tests, some stretches, some exercise, and also just knowing how your pain behaves so that we know if that muscle is a factor or not. Now, the key thing is when you're treating this muscle is to make sure that you don't go too hard at it. Okay, so if people are trying to hack into your tummy, going too hard in through those, as I said, those quite sensitive organs that are there, the result can often be that you feel a little bit better, but then all of a sudden you get this really tender feeling in through your tummy, which makes it feel a lot worse. And because there's a lot of nerves that run through there as well, if you're not gentle and you're not treating it the right way, then it can actually cause more harm than good. So even if you diagnose that this is the issue, that this is the problem, the treatment of that issue is actually the most important thing. So doing what you need to do to get that muscle starting to relax, starting to lengthen, and then starting to strengthen is the most important part, and we've got some very secret things that we do here at the clinic to get that all going. And if you've had your psoas treated here in the past before, you'll know what I'm talking about there. We use a technique back from the 60s and 70s actually, the big red textbooks that tell us how to treat that in such a way that you can get the result without causing any undue harm or undue sort of tenderness after treatment. So if you'd like to know more about how we do that, type in psoas in the comments below, and you spell PSOAS. There's a silent P in psoas, okay? So type in psoas below, and that'll get us to start a conversation to see if psoas is actually something that needs to be considered for your low back pain. Psoas in the comments below, and that will get us to start that conversation. You can also click on the link above as well with our low back pain questionnaire as well. You can type in your details there, and you can let us know if we can help you out with your low back pain from there. I hope that's been helpful. That is a very interesting muscle. It's in the front of the spine. It does have a lot of, they actually call it the hidden prankster in the textbooks because it does a lot of different things that often people don't expect. But when we look at this every single day, we find just how important this muscle is in the treatment and management of low back pain. So in the comments, click the link above, and hopefully we can get started with meeting you and seeing if we can get your low back pain journey started once again. Cheers and bye for now.